The devastating effects of the flood, where outbreak of diseases such as malaria and other waterborne illnesses in flood-hit areas of Maiduguri, has raised alarm among health experts responding to the ongoing humanitarian crisis. According to the latest figures from the state government, between 1.5 to 2 million residents have been affected, with approximately 400,000 people displaced. Trustee Sagir Ibrahim has been on the ground tracking the aftermath and providing updates on the situation. Take a look.
Dr. Bashir Mohammed, a medical activity manager at Medicines Sans Frontières, raised concerns about a possible rise in waterborne and other illnesses due to the living conditions of some of those affected.
When you go to those camps, the first thing you notice is that those people do not have good latrines, and also safe drinking water may not be enough in some of the camps. The week before the flood, we've seen just around less than 300 admissions in a week. But after that, the week after the flood, we've seen at least 100 more cases being admitted. We've seen patients presenting with diarrheal diseases. We might not say definitely it's cholera, but there are signs and symptoms suggesting that.
He also alerted of a possible rise in cases of malnutrition.
This is a period of the year which we expect decline in the number of cases of malnutrition. But unfortunately, we're seeing increase now again. And this can be directly linked to the flood because people do not have probably food to eat, and the children are not getting the required food and nutrient for them to grow.
Due to the impact of the flood on health facilities, the medical experts revealed that several women suffered complications.
Women were not able to access the healthcare facilities to immunize their children. We had women who were trapped in the community that went into labor, and at the point of labor, there was no skilled birth attendant that attended to these women. We've had women who delivered on their own, and because of bleeding, they were rushed here, and at the point which they presented, the blood level was already low.
Access to sexual and reproductive health care for women is also a matter of significant concern. Many displaced women now living in makeshift camps around the state capital have reported a lack of privacy and inadequate facilities for proper disposal of used sanitary material, which only adds to their struggle.
If we go back to our communities, where will we stay? This place is untidy and unhygienic. It's the same place that you will sleep, that someone will pee and even defecate. It is also filled with mosquitoes. We are also scared of cholera. Some of us will want to change or dispose of the sanitary materials, but there is no privacy.
The experts called for more support to address the pressing health needs of the displaced population. With the looming threat of disease outbreaks, malnutrition, and insufficient access to healthcare, particularly for women and children, efforts to restore health facilities and provide essential services are critical as the affected persons try to recover from the devastating flood's impact. From Maiduguri, the Borno state capital, Sagir Ibrahim for Trust TV News.